So all of us, we want to be able to retire and be comfortable, right? We'll also have to know what that takes a lot of planning and money, but it doesn't have to be impossible, right? So I spoke with David Donhoff from Leverage Planners about a new long-term care insurance that our state is launching and what you need to know about it.
Governor Inslee and the legislature passed the Washington State Long-Term Care Trust Act. And what that does is long-term care insurance is an insurance coverage that pays for your nursing home care, chronic care, the things that need to be paid for when we run out of regular health insurance, because our regular medical coverage typically only goes for about 60 to 90 days of expenses. Now, prior to this act, it was covered from something called Medicaid. And Medicaid is not Medicare. Medicare is our health insurance when we retire. Medicaid is basically insurance for when you're absolutely broke. Hopefully, when we all get a chance to live long enough, we're going to want to either age in place at home where we're comfortable or in a nice, clean, pristine environment, and that's not available under Medicaid. So under Inslee's Act, to give you an example, $100,000 household income would pay about $580 a year. And in order to qualify for the long-term care, the state insurance, you have to have paid in for 10 years. So that's about $5,800 to pay in. And what you get in return is about $35,000 of long-term care coverage. Now, if you look at what it costs to be in a nursing home, that's going to cover you roughly about 3, 4, maybe up to 6 months, and that's it. So is it better than nothing? Yes, but there's better ways to go about it.
Well, what about inflation or something of that nature? I mean, is that what would be $35,000 now go down to $15,000 in the future? And can it be used at any facility?
The state act has no inflation coverage, which means that it will not increase, but the cost of healthcare is absolutely increasing every year. The tax, however, is subject to increase each year. Furthermore, what you pay in is use it or lose it. If you pay and you never end up using the long-term care coverage, then that's how it goes. It's an outstanding deal for the taxpayers of Washington State, because without this deal, without people who would not do their own long-term care, they're going to fall on Medicaid. And Medicaid is not a federal program. It's split 50-50 between the federal government and the state taxpayers. So to have a program like Inslee's put forth that forces people to at least get a very bare minimum of coverage is good for us as taxpayers. It's not good for us as individual people being covered.
Just so I'm clear, this is not something you opt into. This is now going to be something taken out, whether you like it or not. So if you don't like it, then you need to get on it and get your own plan in place.
That's exactly right. If you want out, if you want better, and you want to avoid paying the taxes, you need to make a move now before November 1st.
I'm glad that you told us the distinction, and I think it is great. I'm glad that our lawmakers are working to protect everyone. What would the process be like, and how can you help?
Sure. So you need to work with somebody. It could be us, could be anybody, somebody that specializes in long-term care coverage for retirees. And now there are traditional long-term care policies that you pay every month, every quarter, every year. And every year that you stay healthy, that's money gone, right? And then there's something called asset-based long-term care, which has been around now for about 7 or 8 years. And it's a far better design for most people, where you make a deposit to an insurance company and your money's not lost. If you end up needing critical care, long-term care, chronic care, every dollar that you put into deposit equals $3 of spendable support. But if you never use it, never need it, you can take it all back, or all the money can go to your kids. So you're never losing money along the way.
And I understand that you actually do have a special offer for the New Day viewers to choose.
Yeah, so we've got a real easy way to solve this. Most people that build up a safety net, they keep that safe money somewhere. Money market accounts, checking, savings, CDs, whatever. And we can reposition that savings into an insurance account savings. It's not going to make much money, about the same as the bank, but it'll equal 2 to 3 times the dollars you put in and make you exempt from the new taxes. Now, if you get this in place as we see how things work out, if you don't like it, you can change it, absolutely no penalties, and get all your money back without any costs or charges. So it's a real easy program to take advantage of that both covers you in a far better way than you'll get from the state and exempts you from the new taxes.
Now, if you need help in the financial department and you want to reach out to David and the Leverage Planners team, just call the number on your screen or visit the link on New Day's website. So grateful for him, always breaking it down into simple terms that we can all understand. All right, well, if you're looking for some other ways to make money, why not try selling some items you already have? Up next, Antiques appraiser Dr. Lori joins us to tell a few of our viewers what their items are worth. We'll be right back.
This portion of New Day Northwest is sponsored by Leverage Planners.